Good evening, everyone, and welcome to Maine's Mammograms is Not Enough first event of the year. And I'm so excited tonight. We are going to be celebrating Women's History Month, and we have a dynamic speaker. For those who don't know me, my name is Dr. Katrina Shaw. I'm the CEO and founder of Maine, which stands for Mammograms is Not Enough. And what Maine is a 501c3 nonprofit, and we are dedicated to breast cancer awareness. We enlighten women of the importance of diagnostic screenings. We provide and assist women who don't have insurance and to pay for extra diagnostic screenings and expenses, in addition to educational resources to help promote early detection and prevention. Our fundraising program is called the Diagnostic Screening Assistance Program, where we do provide assistance for diagnostic screening and any other expenses actually associated with the disease. And you can find a form on our website to get assistance. We actually have quarterly meetings, and we have a survivorship program that we launched last year. So I'm so excited. Maine actually, this month was actually their 5th year. And the 5th year anniversary was actually March the 7th. So I am excited about that. So I would like to just tell you a little bit about myself and why that I birthed my nonprofit. I'm a 10-year breast cancer survivor. And actually my diagnosis, reason why it's called mammograms is not enough, because it was actually caught on a diagnostic screening. And for those that don't know what a diagnostic screening is, it's a mammogram along with a sonogram. And most women that need a diagnostic screening are those that have some kind of concern. I happen to have had a cyst on my left breast, so I will always get diagnostic screenings. And at this particular time that I went for my annual mammogram to get my diagnostic screening, that the radiologist just happened to notice that it wasn't a cyst that he saw in my left breast after when he was doing a sonogram. And he said, you know what, that looks like a fried banana. And I said to him, like, what is a fried banana? So when we go to the doctors, we always got to make sure we ask questions. So he explained it to me. He said a fried banana is it's a benign lump, but because of members cancer on the screenings, that we will have to do a biopsy. So I went and got a biopsy done. And when a woman gets a biopsy done, the procedure is for her to get a titanium clip put in so they can mark the exact location if they have to go back in. And I did not feel comfortable with that. I said, no, I did not want them to do the clip. And that was only God putting it in my spirit just to say that, just say no. So they did the biopsy without the clip. And I went back, everything came back benign. I went back the following year, everything was okay. They said things were going away. But then the following year when I went back, I did not go in the same actually location where I get my mammograms done. So they did the regular mammogram. They didn't do the diagnostic. That was the first year they didn't do the diagnostic. So when they said, well, we'll call you back if we see something. So 2 weeks later, they called me back and they told me I had to get a biopsy done. So I was like, oh my God. So I went on my lunch period. I was there for like at least 3 or 4 hours. And I was just concerned because they were looking at the same breast I had the biopsy from. And I did hear the radiologist said something about a nodule, but it didn't click at the time. So I went in finally after they kept looking at the regular mammograms. They said, well, let's do a sonogram on her. They did the sonogram. They saw something. So they said, okay, we're going to have to do a biopsy. So this time when I didn't want to get the clip. They was like, no, we're going to have to put the clip in. So I knew that was God preparing me that they will have to go back in. And so 2 weeks later, I got the dreadful news that no woman wants to hear is that Katrina, you have breast cancer. No family history, devastated. I was working out, in shape, felt that I was eating right. I just could not believe, how is this happening to me? So like I said, I got the phone call at work. I was devastated. I went home, never forget the day, told my husband, and just so happened that he got diagnosed with prostate cancer a year before I did. So it was just crazy. And he had no family history either. So I remember, never forget him saying to me, if God did it for me, he will do it for you. So the first step we had to do was go see the doctor for my options, to see what options that I would have. And I will never forget, when I went to see the doctor for the first time, the surgeon said, "You are blessed that your radiologist looked further because your mass could not be seen or felt on a regular mammogram screening." And because I had breast cancer, I was just so happy that they found it early, and I had so many options. I was diagnosed for invasive ductal carcinoma, that means when they find it in the milk ducts. But by the time they finished the surgery, and I ended up having no chemo or radiation, I was stage 0 DCIS. So I'm going to let you know why and how that my one dose saved my life. Now, when I tell you that they actually called me back because they saw something, what they was looking at was the heart nodule that I had. But because I said no, and I didn't get that titanium clip, they didn't to mark the exact location. They did not know. So if I would have had the clip and never said no, they would have never called me back. And that's where mammograms is not enough came from. And I said from that time on, God saved me. And I said, I'm going to make sure I let women know. I birthed my nonprofit. I started off with a blog and said, I'm going to let people know mammograms is not enough. And that's where my nonprofit came from. I educate, I advocate, I do whatever I can do to let, because men get breast cancer too, to let people know that mammograms is not enough. And that's where Maine came from, the name. So I'm just so glad I'm here today to inspire, educate, and let women know, so people can know that early detection is the key, and not be where I am, if they can catch it early and have more options and less hardship. So I want to go on to introduce our favorite guest for tonight. I'm excited about her. So I'm going to go ahead and introduce our guest for tonight. Her name is Dr. Chalice C. Rhodes. She is a licensed professional counselor, national certified counselor, a board certified telemental health counselor, and serves clients in Georgia, Florida, Delaware, and New Jersey via her private practices. She specializes in empowering women to reach their full potential while supporting their transformation to authentically live their best lives despite their lives' challenges. She also utilizes her 12 years of higher education teaching experience to develop and deliver relevant and creative courses through her own app, which is called Dr. Chalice Teach. In addition, she is enthusiastic about health, equity, and health disparities, providing diversity, equity, inclusion, and belonging, and in consulting. And I'm so glad you're here today, Dr. Chalice, to speak for us tonight.
Thank you so much, Dr. Katrina. I really appreciate the warm welcome. And so I'm going to jump right into the slides, ladies. I'm going to share my slides with you all, and we are going to jump right into our presentation. All right. So this presentation is called Beyond the Lump, Unveiling Disparities in Breast Cancer Care and Holistic Well-Being. So who am I? I'm a mother, a daughter, a sister, friend, aunt, godmom, athlete, praise dancer, and singer. Dr. Katrina announced all of my credentials. I am a breast cancer survivor. I, like Dr. Katrina, am so grateful to God for my life. You know, in 2017, they said, oh, you have a cyst on your breast. You're going to start getting ultrasounds. You have dense breasts. But nobody really told me that that was a risk factor. Nobody told me dense breast was a risk factor for breast cancer. And they didn't really seem concerned about this cyst. I didn't seem concerned about it either. So I went on living my best life now. And in 2022, when I had my mammogram done, I am so thankful for the radiologist who said, we don't think that this is cancer, but we're going to just biopsy it just to see. And so I went to get the biopsy. And sure enough, it came back DCIS, or stage 0 breast cancer. And so I had surgery to remove it, which is called a lumpectomy. And then I had to wait about 6 weeks to get a mammogram to make sure they got all of the cancer out. And then I completed 22 radiation treatments. So I'm so grateful to say that I'm a breast cancer survivor. And when I met with my surgeon said to me, wait, what do you do for a living? I said, I'm a therapist. And she said, we need you. She said, I have nobody to refer my clients to, my patients to. And about 2 weeks after she said that, I received an email from one of the insurance companies that I'm contracted with through my private practice, and they were asking providers to become psychosocial cancer oncology behavioral health specialists. And that's the picture that you see here. In honor of Breast Cancer Awareness Month, when I was going through my own treatment, I was determined to complete this certificate program. And, I heard the calling from God to use my professional counseling skills to reach out and help our breast cancer survivor community. So here's a little bit about me. So we are going to discuss the intersection of breast cancer, mental health, and health equity research. We're going to analyze breast cancer, mental health, and health equity research. We're going to apply race, gender, identity, and religion to breast cancer, mental health, and health equity. We're going to explain stress and evaluate ways to build resilience. And then we will discuss your holistic breast cancer experiences. So just a little disclaimer, we agree that I'm not providing any mental health therapy services, healthcare, medical advice, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue, disease, or condition. The information that I'm providing is not intended to be a substitute for professional advice, diagnosis, or treatment provided by your own medical and or mental health provider. And you agree and acknowledge that I'm not providing medical advice, healthcare advice, mental health advice, or religious advice in any way. You want to always seek the advice of your own providers regarding any questions or concerns you have about your specific health or any medications. So let's take a look at breast cancer statistics. 1 in 8 women will face a breast cancer diagnosis in her lifetime. And the chance that a woman will die from breast cancer is about 1 in 39. So that's about 2.5%. Currently, there are more than 3.8 million breast cancer survivors in the United States. Now, how does breast cancer affect Black women? We have a higher chance of developing breast cancer before the age of 40 compared to white women. We also have a higher death rate. So, and 1 in 5 Black women with breast cancer have triple negative breast cancer, which is a very aggressive form of breast cancer where there is no specified treatment. So this is really important. And at every age, Black women are more likely to die from breast cancer than any other race or ethnic group. Okay. Also, there is a 4% lower incident rate of breast cancer than white women. So we actually have a 4% lower incidence rate of breast cancer, but we are up to 46% higher. We have a 46% higher chance of dying from breast cancer than white women, which is why it's so important to raise health equity and breast cancer disparity concerns. Also, there is a 6 to 8% gap in the 5-year survival rate between Black and white women for every breast cancer subtype. When we take a look at breast cancer in Latina women are diagnosed at a later stage, and they are more likely to die than white women. There is a lack of access to healthcare and difficulty navigating the healthcare system. And also, Latino women face language and cultural barriers, financial constraints, and also a lack of transportation. Looking at the Asian community, Asian women are more likely to be diagnosed at a later stage and are less likely to receive timely and appropriate care. They are also more likely to have aggressive types of breast cancer, which can lead to poor outcomes. Asian women are more likely to be underinsured, uninsured. There's a language or cultural barriers, and they participate less in research. In terms of Native American women have a higher rate of breast cancer mortality than any other racial or ethnic group in the United States. They are also diagnosed with breast cancer at a more advanced stage compared to white women. And their cultural and spiritual beliefs can delay treatment. Also, there's difficulty accessing treatment. There are high poverty rates in Native American women. And so early detection awareness is key for all women, but especially in the Native American community. When we take a look at Eastern Indian women, there's a lower prevalence of breast cancer among Eastern Indian women, but breast cancer is actually the leading cause of cancer deaths in Eastern Indian women. This is due to a lack of access to early detection and preventative care. Also, Eastern Indian women are diagnosed at a later time and they receive inadequate treatment. Also, their cultural beliefs and their taboos can sometimes play a role in delaying treatment or receiving treatment or getting preventative care. So, again, early detection is key. Breast cancer in Pacific Islander women. Pacific Islander women face higher rates of breast cancer and late stage diagnosis. There are also cultural barriers to accessing healthcare, and there's a greater financial burden among Pacific Islander women. Culturally sensitive approaches to care are key. And again, we need to increase the awareness about breast cancer and its risk factors. When we take a look at breast cancer in men, in 2020, approximately 2,620 new cases of male breast cancer occurred in the United States. Risk factors include a family history of breast cancer, radiation exposure, obesity, and the use of certain medications. Symptoms in men: a lump in the breast, nipple pain or retraction, and skin changes such as redness or scaling. So men have the same exact symptoms that women have. Let's talk about breast cancer and mental health. Listen, our mental health, which is our thoughts, our feelings, and our behaviors, also includes our physical health, which is our diet, our exercise, and our nutrition, and also our spiritual health. So when we take a look at mental health in breast cancer patients who are newly diagnosed, the most common disorders are anxiety, depression, stress, adjustment disorder. An adjustment disorder is when something happens in your life, a major life transition happens, like receiving a breast cancer diagnosis. We can expect common mental health symptoms for the first 3 months after you learn of a diagnosis like breast cancer. So that would be adjustment disorder. Okay. And these disorders are very common among people who are newly diagnosed with cancer. There's also this study also found an increased healthcare cost in the first year following breast cancer diagnosis. And that would make sense, right? You know, like for me and my story, you know, getting diagnosed with the breast cancer, having a lumpectomy to remove it, having ultrasounds, biopsies, mammograms, to confirm that the cancer was removed, having radiation treatment. You know, for some survivors, you've had chemotherapy. Some survivors have to take, you know, a certain pill for 5 to 10 years. So we could see why healthcare costs would be increased that first year. Let's take a look at breast cancer survivors compared with women with no prior cancer diagnosis. So there's an increased risk of anxiety, depression, suicide, stress, adjustment disorder, and post-traumatic stress disorder actually occurred in 10% of women survivors. Also, neurocognitive disorders, impaired memory, reduced concentration, slower information processing, reduced executive functioning, cancer-related cognitive impairment, or what many of us know, the common term chemo brain or brain fog. Now, sexual dysfunction is something that, you know, is not talked about a lot, but it really is a part of what happens for some women. some and men, right? Because breast cancer can happen in women and men, but there can be difficulties involving the desire to even want to have sex, maybe being aroused or lubrication, feeling lubricated. Certain treatments may cause vaginal dryness, certain difficulties with achieving orgasm, having actual pain with sexual intercourse, having body image concerns, for women who have had mastectomies, having concerns about their bodies, even the radiation treatment, any effects from the radiation treatment. When you receive radiation, and my surgeon warned me, she warned me it would be like a severe sunburn. She revealed to me that, the breast shrinks. So, your breast shrinks and lifts, and it can cause a difference in how both of your breasts look. So there's a lot of body image concerns that can come, scarring, um, you know, um, maybe even keloiding from having a port inserted. So there are many, body image concerns that are very common for mental health survivors and thrivers. Also, infertility is a huge concern. We know that, breast cancer diagnosis in the younger population is escalating, and for women who have never had the opportunity to have children, sometimes breast cancer treatment, depending on what line of treatment you have to have for your type of breast cancer, it causes some women to go into early menopause, impacting their ability to have children. I've talked to other survivors where they were told they couldn't have children and they actually became pregnant after treatment. But, infertility and the lost dreams, the grief and loss that comes with that, there's a lot of grief and loss that's not talked about that's involved with a cancer diagnosis. All right, let's talk about mental health disparities. So, in the Black community, there are higher rates of depression, post-traumatic stress disorder, and suicide. In the Black community, there is inequitable access to mental health care and a lack of culturally competent mental health care providers. There's high levels of stress due to systemic racism, discrimination, and post-traumatic slave syndrome. In the Hispanic race, mental health disparities include language barriers, cultural stigma, low socioeconomic status, and again, inequitable access to mental health care and a lack of culturally competent mental health care. There's high levels of stress, again, due to systemic racism and discrimination. In the Asian race, language barriers, cultural stigma, low socioeconomic status, inequitable access to mental health care, lack of culturally competent mental health care. Look at all of the overlapping factors that cut across race. In the Asian race, there's high levels of stress due to racial discrimination and Islamophobia, which is not, discussed a lot, but this is also faced in the Asian race. In the Native American race, higher rates of depression, post-traumatic stress disorder, and suicide. And again, inequitable access to quality and affordable mental health care. There's also a cultural stigma in the Native American community. Again, high levels of stress due to systemic racism and discrimination and historical trauma in the Native American race. In the Eastern Indian race, Eastern Indians can be reluctant to seek help due to their cultural beliefs that mental health or mental illness is a sign of personal weakness. And again, inequitable access to quality and affordable mental health care, also a lack of insurance coverage or the inability to afford quality mental health services. There's also language barriers that make it difficult to access mental health services or communication with healthcare providers. There's also barriers there as well. In the LGBTQIA population, there are higher rates of depression, anxiety, and suicide, high levels of stress due to systemic discrimination and prejudice, and again, a lack of culturally competent mental health care, limited access to quality and affordable mental health care. When we talk about mental health disparities in gender, specifically women, depression, anxiety, and postpartum depression is very common. Women are more likely to also experience trauma, such as sexual assault or intimate partner violence. Women of color are disproportionately affected. Women in rural areas and low income communities have fewer mental health services available to them. There's also gender based discrimination and inequality in access to care and resources. Let's take a look at mental health disparities in men. There are higher rates of substance use disorders, suicide, and underutilization of mental health services. Men are also less likely to recognize that they have a mental health issue. They're more likely to deny or ignore the problem rather than seek help. And they tend to be more reluctant to talk about their feelings or thoughts. And we know a lot of this is related to culture, the culture of men, gender socialization, socialization in their families. There's also a lack of awareness of mental health issues, concerns about stigma related to seeking help, a lack of understanding of what resources are actually available to them, issues related to their masculinity, such as feeling that they need to be strong and not appear weak. When we talk about mental health disparities and religion, this is a really important topic because, again, our mental health is holistic. We are mind, body, and spirit. So our mental health includes our physical health and our spiritual health. So here we're going to take a look at Christianity in particular. In the Christian religion, there's a lack of focus on mental health in the Christian community. Many people believe that mental illness is a sign of spiritual weakness or punishment from God. Right. There's a fear of stigma and discrimination because of their faith. In a Christian religion, it's almost like for some people, if they reach out for help and ask for help, they may be told, they may be sent messages, you're lacking in faith. You need to have more faith and trust in God. And it's not that they're lacking in faith, or maybe they are, but there's nothing wrong with your faith and therapy, or like I like to say, there's nothing wrong with Jesus and therapy. Some denominations provide spiritual healing rather than medical treatment, and medical treatment is just not in the form of therapy. Like, I'm a therapist, I'm not a medical doctor, I'm a doctor of philosophy, right? But a medical doctor can prescribe medication. Sometimes we're at a point in our mental health journey where maybe our serotonin and our dopamine levels are low. And so a psychiatrist may say, hey, I'm going to prescribe you this antidepressant medication to help increase the dopamine and the serotonin levels in your brain, because we think that there's a biochemical connection. So we want to prescribe you this medication to help increase those levels in your brain. And we also recommend that you go to therapy and talk to a therapist as well, because we know that our mental health is multifaceted. Just the medication can help, just the therapist can help. But if needed, if you're at that level where you need the combination of the two, there's nothing wrong with that. And for some people, they don't actually need medication. Sometimes just talking to a licensed professional, such as myself, and using the evidence-based techniques and therapy practices that we utilize, that we know years, decades of research that has proven to help people overcome depression, anxiety, stress, suicidal thoughts. We use those techniques to help you. And sometimes that is all you need. And you can combine that with your faith. You can combine that with, and I'm also a Christian counselor, right? And so with my clients who seek Christian counseling, I pray with my clients. I provide scriptures, for my clients. You have your church communities where you can fellowship and receive the word of God in your Bible studies or your sermons. So, the combination of therapists, Christian counselors coming together with ministers and pastors and people in the church and programs in the church really can give Christians a great holistic perspective of help to help them get well. But there is a lack of mental health professionals in Christian communities who actually understand the unique needs of those from a faith-based background. And that's why I feel so blessed that God called me 20 something years ago to be a Christian counselor, and that I can give back to my community as a culturally competent and humble provider. Let's move on to mental health disparities and the Muslim community. So in the Muslim community, there's stigma, there's a lack of access to services, and there's differing cultural understandings of mental health in the Muslim community. Religious and cultural beliefs that mental illness is shameful and should be kept hidden. Cultural differences can lead to misunderstandings and misdiagnoses of mental health issues in the Muslim community. So there really needs to be a focus on destigmatizing mental illness and increasing access to culturally sensitive services. Community-based services should be made available, and there really needs to be a greater awareness and education about mental health issues in the Muslim community. Let's move on to Judaism. There's a lack of culturally sensitive treatment. There's a lack of knowledge and understanding of mental illness, and a lack of resources for Jewish individuals seeking professional help. There's a fear of being judged or labeled as crazy by their community. Additionally, research indicates that Jewish people are more likely to suffer from depression and anxiety than other religious groups. So, in Judaism, we need to increase awareness, create resources, and support systems within the Jewish community. Hinduism. In Hinduism, there's a greater risk of developing mental illness, cultural stigma around mental illness, a lack of access to mental health services, and limited knowledge about mental health issues. In the Hindu religion, cultural values such as the belief in karma may lead to a perception that mental illness is caused by past actions, or that it can be cured through spiritual practices instead of seeking professional help. And interestingly, I have heard, people in a Christian community, wonder like, oh my God, am I reaping what I've sown? Is this happening to me? Did I get a breast cancer diagnosis because of something that I did? So it's interesting that these same type of issues can cut across different religions, but be called something different. Okay. Also in Hinduism, there's a fear of stigma or judgment from their peers. Also, accessibility and culturally appropriate mental health services and resources. In Buddhism, some studies suggest that Buddhists may experience lower levels of mental health problems. Other studies have found that Buddhist practices such as meditation and mindfulness may have a positive effect on mental health and may reduce symptoms of depression and anxiety. Buddhism emphasizes compassionate values, which may lead to reduced stigma associated with mental health issues. So now let's talk about the multifaceted model of depression in African American women created by my colleague and I, Dr. Bernice Kennedy, and myself. And this talks about kind of everything that we just talked about, right? In the Black community, we have to consider biopsychosocial spiritual factors, because in a Black community, there is such a high spirituality and or religiosity in the Black community. So we know religion and spirituality are two different things, right? Spirituality is our relationship with our higher power, our relationship with God. Religion talks about a specific denomination or a specific organization. So those things are two different things. But with Black women and depression, what we find is that environmental factors play a role, health factors play a role, socioeconomic factors play a role, cultural, spiritual factors play a role. The strong Black woman, the strong Black woman archetype plays a huge role. And do you guys know what we found in this model? We found that strong Black women have a difficult time asking for help, and this contributes to clinical depression. Clinical depression is different than grief and loss or just feeling sad. Clinical depression is a certain number of symptoms in the same 2-week period. It involves impact on multiple areas of your interpersonal life, your work, family, social life. All right. And so the faith-based community is actually an intervening condition for Black women. Our faith is so strong in the Black culture that it actually helps to buffer us and to make us better. So can you imagine combining your faith-based community with a Christian counselor and what great work you could do with both of those communities combined? So what we need to do is we need to develop culturally sensitive tools and practical and reliable and valid scales to assess the unique factors of depression in African American women. Okay, we have to provide culturally sensitive treatment to all populations, right? We need culturally competent providers and providers who have cultural humility, all right? And we need to train healthcare providers in this. So one of the things that I do is I train healthcare providers in motivational interviewing, how to be empathic with clients, how to reach people and connect with them, even if they are of an opposite culture. Now, we can't leave out physical health. We talked about mental health. We talked about spiritual health. We have to really pay attention to our physical health because approximately 30% of breast cancers may be preventable with changes in lifestyles. And like Dr. Katrina, I was shocked as well, Dr. Katrina. Like Dr. Katrina shared, she was working out, she was fit and everything. Me too. I've been an athlete. I've worked out all throughout my life, all throughout my pregnancies and everything. So it is a shock when you're finding out you have breast cancer and you're following these guidelines to be physically healthy, because excess body weight contributes to breast cancer. That's why we have to make sure that we're physically active. Alcohol intake increases. I know this is one that a lot of people that don't like to hear for people who drink, but alcohol intake, it contributes to breast cancer. So you really want to, take a look at your alcohol intake. Also, what more can we do in terms of our physical health? Medication, taking the medication as prescribed, adhering to it. If it says take the medicine once a day, you have to take this medicine. For instance, tamoxifen is a popular medication that is prescribed to breast cancer survivors and thrivers. And if you have to take one pill a day for the next 5 years, sometimes it's hard to adhere to that because the side effects could be so bad, nausea, vomiting, even with the chemotherapy, loss of hair, when we talk about body image and when we talk about a Black woman's hair, we know what our hair means to us, ladies, and for any woman to lose her hair, but, particularly in the Black community, what our hair symbolized through the generations, it can be really tough. We need to get our annual mammograms every year. We really do. An ultrasound or an MRI. If you have dense breasts, ladies, advocate for yourself, please. If a provider tells you that you have dense breasts and they do not recommend that you get an ultrasound in addition to your mammogram, advocate for yourself. Speak up and ask for an ultrasound because dense breasts are a risk factor for breast cancer. And I never knew that. And I have dense breasts. And sometimes an MRI is needed. So, for me, thank God, by the grace and mercies of God, I finished radiation treatment December 2022. last July was when I had my first mammogram and ultrasound to confirm that the cancer was gone. And thank God my ultrasound and my mammogram came back clear. Now, from the lumpectomy, sometimes you can still have cysts. And so she did, I read the report, and she did also recommend an MRI. So I will be getting an MRI just for peace of mind, because one of the things that cancer survivors and thrivers face, and it's common, you're not crazy and there's nothing wrong with you. Anxiety, scanxiety is very common. And a real common concern of cancer survivors and thrivers is, oh my God, is it going to come back? And so I want to have an MRI just to check and just to make sure that everything is okay, because that's what it said in my report. So read your doctor's reports, even though read all the fine print and read all of the recommendations, and then advocate for yourself and speak up. And when I had my checkup appointment with my surgeon a month ago, I spoke up and she did my exam. She said, everything looks great. And I said, thank you, doc, but I still want to have an MRI just to make sure. And she said, no problem. She explained the risk and the benefits to me. She said, MRIs are much more sensitive. And if they do see something on the MRI, they don't wait to see, they immediately send you to get a biopsy. So she did. And I said, and I'm just fine with that, because if you do see something, I'm not excited about the biopsy. You know, the biopsy that I did have, when I had it, I started bleeding out. I literally had to stay for like an extra 20 minutes, and they had to compress my breast to stop me from bleeding, because I was bleeding out, you know, and who knows, it was probably because, hey, it came back confirmed that I had breast cancer, you know. So speak up and advocate for yourself. Also, genetic testing. Get your genetic testing done. You know, I never knew breast cancer ran in my family, ladies, until after I was told I was diagnosed. When I was diagnosed with breast cancer, I had an aunt that reached out to me and said, oh my God, you have breast cancer? Well, two of your grandmother's sisters had breast cancer, and your grandfather's sister had breast cancer. So breast cancer actually did run in my family, and I didn't know it. It actually skipped a generation and landed on me, but it landed on the wrong person, because I'm thankful that God saved my life, and I'm turning my pain into purpose by giving back to our breast cancer survivor community, educating the masses, giving therapy, providing individual therapy, group therapy, and all of the things. So God is using me to turn pain into purpose. So you want to advocate for yourself and get genetic testing, clinical research trials. Ladies, we all, minority women, we have to enroll in more clinical research trials. You know, research has shown that, for instance, Black breast cancer is different than white breast cancer. So we need treatments tailored to what is going on in our genes, which is why we need to enroll in clinical research trials, so we can help ourselves. It may not help you right now, but it'll help the next generation. All right. In terms of spiritual health, let's take a look at a study with 8 focus groups of 40 Black women. There's high levels of spirituality in African American survivors. Collectivism is associated with higher levels of spirituality. Married women showed higher levels of spirituality versus single women, and attitudes about the efficacy of cancer treatment were not associated with spirituality. Here in this study, we're taking a look at 23 Black breast cancer survivors. Prayer was used as a coping skill and increased hope through our spirituality, connecting with God, connecting, having your daily quiet time in the mornings, going to Bible study, going to church, increased your hope, increases our hope that we will be okay. And connecting with our spirituality resulted in higher levels of psychological well-being. So see, you can't really separate mind, body, and spirit. It's a holistic approach that goes hand in hand. Also, in this study of 8 focus groups of 40 Black women, the Black women said that God enables breast cancer survivorship and works every day in our lives. And I know, as a Black woman, I agree. Also, the healthiest thing about us is that we are strong African American women. That's what women were reporting in this study. Now, ladies, we can't deny it now because, it's in our DNA. It emanates from slavery. We do have strength in our community, right? But we don't always want to be strong. And it's okay. We shouldn't always have to be strong. You hear a lot of talk now of a soft season, Black women not wanting to be strong, wanting to have a soft season. We could be both. I don't think that we should deny our strength, our resilience. I like to use the word resilience. We can't deny our resilience, but do we have to operate in that all the time? We should be able to have support, and we should be able to fall back and have our soft season. But unfortunately, because many Black households, over 60% of Black households are headed by single Black women, a lot of times Black women don't feel like they have the help, or when they do have the help and they ask for the help, they're not supported. It's not done the way they want it done. It's half done. So they figure I'll just do it myself. There's all of these things that play into the over independence of Black women. Also, there's a need for community-based participatory survivorship interventions that are culturally and spiritually consonant and peer-based. What this basically means is that Black women need to have a voice. Black women from faith-based communities need to have a voice in the treatment that they receive. Now we're going to go on and talk about stress. Stress is a state of physiological or psychological strain caused by adverse stimuli, physical, mental, or emotional, internal or external. It tends to disturb the functioning of an organism, and which the organism naturally desires to avoid. There's physical stress, emergency stress. An emergency happens and you're stressed. There's continuing stress, life stressors. This typically happens through relationships. There's psychological stress, stress that happens in our minds with our thoughts, our feelings, which causes us to behave a certain way. And I help people with that piece as well. There's prolonged stress. Prolonged stress is something enduring. Maybe you're, in a bad marriage, or maybe you have an ongoing disease like breast cancer. Maybe the breast cancer came back. Maybe you have some other health condition that's prolonged. Maybe you're struggling with high blood pressure or diabetes. And then there is spiritual stress. You guys know another name for spiritual stress? Spiritual warfare. And if you go to your scriptures, Matthew 18:18, you will see how God has given us the power to bind and to loose. So we can bind a spirit of heaviness. A spirit of heaviness is that depression, that anxiety, those things that weigh you down, even suicidal thoughts. Well, we can bind the spirit of heaviness, and we can loose the Holy Spirit, the comforter. We can loose the garment of praise, the oil of joy. We can bind the spirit of infirmity that comes in a form of cancer, and we can loose the spirit of life and gifts of healing. We can bind the spirit of fear that comes upon us when we first hear the word cancer, the ongoing anxiety that happens when we have to get our annual mammograms. We can bind that spirit of fear and loose love, power, and a sound mind. We can bind the spirit of death, and we can loose the prince of life. So here's a way to apply your Christianity, for example, in terms of stress and spiritual warfare. Now, listen, I said I love the word resilience. According to the American Psychological Association, resilience is the process of adapting well to adversity, trauma, tragedy, threats, or stress, and bouncing back from difficult experiences. Research has shown that resilience is not ordinary. It's not ordinary. It's not extraordinary. I'm sorry. Resilience is not extraordinary. Resilience is actually ordinary. That's why we cannot deny our strength as women. We really can't. Resilience is ordinary. It's not a trait that people either have or don't have. It actually involves intentional behaviors, thoughts, and actions, and it can be learned and developed in anyone. Excuse me. I'm going to get a little something to drink, ladies. Here are some resilience factors: having caring and supportive relationships, both within and outside of your family, love, trust, positive role models, encouragement, and reassurance to support your resilience, making realistic plans and taking steps to execute the plan, having a positive view of yourself and confidence in your strengths and abilities. Communication and problem solving skills are essential. The capacity to manage strong emotions and impulses. In other words, emotional intelligence. Here's a little exercise, but we're going to skip that and we're going to go over ways that we can build resilience. We need to make high quality reciprocal connections. You know, a lot of times as women, men too, we struggle as people pleasers, and we may find that we have a lot of one-sided relationships. We really want to try to cultivate and engage those high quality reciprocal connections that are give and take. We want to avoid seeing crisis as problems that can't be overcome. It may feel like it can't be overcome, but it really can. We want to accept that change is just a part of living. Change is hard for all of us. Think of anything that you ever wanted to change. You may have said today you wanted to change it, but did you change it right away? No, because there's a whole process of change. Also, ways to build resilience is to move towards your goals. That means take little baby steps. All of these little baby steps add up to the big goal. So do what you can. Be kind and compassionate with yourself. And I just said it, take action, baby steps. We got to look for opportunities for self-discovery. You know, we're all evolving and growing. We all want to transform, right? Because none of us have arrived. None of us are perfect. And there are things that we all can be working on to grow, to evolve, to mature, and to better ourselves. We also want to nurture a positive view of ourselves, having self-compassion for yourself. And we got to keep things in perspective, because, you know, when you hear that word cancer, it's like everything can get out of perspective so quickly, and it's okay. Take the time to go through those emotions, but then you want to bring yourself back to keeping things in perspective. And we want to maintain a hopeful outlook. And we cannot forget self-care. And let me tell you, I do trainings on self-care, and self-care goes way beyond manis and petties and hair and makeup. It goes way deeper than that. Here are some additional considerations. Let's learn from our past mistakes. None of us are perfect. We can learn from our past mistakes and make ourselves better. We want to really try to stay flexible. You know, when we get rigid and stubborn, we block transformation, we block growth. So we want to really try to stay flexible, connect with self-help groups, support groups. Maybe you have support groups through your church, through your sororities, your friend groups. You know, you really want to connect your business communities, nonprofit organizations like Maine. Okay, stay connected. We want to read books. Online resources are helpful. Mentors, having mentors that can mentor us, and licensed mental health professionals like myself can also help. So this is a video on resilience, and I'm going to see if it's going to play here. Let's see, ladies.
When things are going bad, there's going to be some good that's going to come from it. Oh, mission got canceled? Good. We can focus on another one. Didn't get promoted? Good. More time to get better. Didn't get funded? Good. We own more of the company. Didn't get the job you wanted? Good. You can get more experience and build a better resume. Got beat? Good. You learned. Unexpected problems? Good. We have the opportunity to figure out a solution. When things are going bad, don't get all bummed out, don't get startled, don't get frustrated. No, you just look at the issue and you say, good. You go forward. And lastly, if you can say the word good, it means you're still alive. You still got some fight left in you. So get up, dust off, reload, recalibrate, re-engage. and go out on the attack.
When you're making a diamond, three things have to happen. Number one, they have to put you under immense heat. You got to get burned. Don't run from the difficult classes. Take them. Go to the heat, because the sooner you go to the heat, the sooner the dream. Then after the heat, they have to put you under pressure. Little pressure, little progress. Stop taking shortcuts. Stop taking the easy way. Go through whatever God wants you to go through. The final thing you have to do is you got to cut it. It's the cut that makes it valuable. Yes, you have a dream, and the process is not supposed to be comfortable. So if it hurts, if you feel like you're under heat, if you feel like you're being pressured, welcome to the big leagues. When God looks like he's pulling you back, eventually he's going to let you go. And the further he pulls you back, once he releases you, boom. Once you find those things that will make it worth it for you, it is done. It's a done deal. You know people, you've seen people that you can predict early on. That person is going to be a diamond. You know it. How they carry themselves, how they take care of business, how do they follow through, how they keep their commitments to their commitment, how they work the system, their energy level, their passion. You know it. The mark is on them. You know it. That one's going to make it. And people must see that in you. We've all had experiences where we were working on something and we knew it was possible. We took the responsibility to make it happen. Other people couldn't see it. A lot of people didn't believe it. People were opposing it, but you kept on doing it. It was hard, it was rough, it was difficult, but to you, it was worth it. And eventually you got to a level, you know, can nothing stop me now. I'm on the move. I'm on the move.
And there we have it. There we have it. So thank you all so much for listening in on a presentation. I appreciate your time. And if anybody has any questions or answers, I will stop sharing my screen now.
Hi, doctor. Hi. I have a 23-year-old that I'm helping that she had genetic testing and she had to have a double mastectomy. I feel as though that she need to have some mental help. She seems like she is okay. You know, I've been with her, but I'm trying to encourage her
Yes.
to see someone. She wants to, she's only 23, so with a double mastectomy, she wants to gather her eggs in case she wants to have a child later on.
Yeah.
How can I and what can I do to continue to encourage her? Like I said, she's been going like it's okay, but I'm a survivor and I know how it was for me at 33.
Yes.
So she's 23. I've already had a child at that age.
No.
And I'm just concerned, and I want to, you know, for you to, you know, just give me a little tips on how I can encourage her to see someone in counseling that will help her through this, because that's very young.
Oh my goodness, it's so young, and so many women are being diagnosed earlier.
Earlier.
And I hope that, you know, she's connected, like they have groups,
Right.
you know. Yes, so hopefully she's connected in a community. I know you're asking specifically about therapy. And see, that's the thing about therapy and counseling. A person has to want to come for themselves. You know, if they come because somebody else is telling them or forcing them, they don't, you know, they're less likely to benefit from it, even though some people can change.
Yes.
So sometimes it's a matter of really, because it really is a matter of finding a good fit. And what I recommend is I love directories, because when you go to directories, so here's a popular directory that I think you can encourage her to go to, and she could search for the therapist by whatever she's going through, the state that she lives in, You get to look at the therapist's website. You can go to the therapist's website and check them out. Hopefully, like me, like I provide like a free 15-minute video consultation so people can kind of
Okay.
come to me and get a feel for my style, and I can hear from them. So here are some therapy directories that you
Okay.
want to use when you're looking for a therapist. Therapyforblackgirls.com is an awesome therapy directory. Taraji P. Henson has a directory, the Boris Lawrence Foundation. So if you Google that, there's also Health and Hue. They have a directory. There's Psychology Today. So directories can help. Maybe if she could see a therapist that looks like her or somebody that she can connect with on the website, or go to their social media pages and watch a video or a YouTube channel, that might help her to feel more comfortable. But you know what's really important? Sometimes it just takes time, because sometimes people don't want that help right away because of the grief and loss process they're in, or whatever it is that they're going through. They're not ready. But there will come a time, hopefully, your encouragement and the seeds that you're planting will eventually start to sprout up. And one day she may be like, you know what? I think I'll give it a try. So patience is key, and just keep planting the seeds gingerly. You don't want to overwhelm her, with it, because again, we want to keep in mind that, it's when people feel comfortable and in their time. So I hope that helps. Anybody else have any questions or concerns?
My other question for you would be the clinical trials and genetic testing. I noticed that I've had some Black women to say, oh, I don't want to do the clinical trials because they just want this or they want that. They're using me. I try to express to them that we as Black women need those clinical trials, because that's the only way we can help ourselves in women who have been diagnosed. So I see that it's a problem sometimes with the clinical trials. And if it's any buzzwords or anything that might be able to help them to sign up for clinical trials, that would be, great.
Yes, well, that's a great question. And I think the organizations that specialize in that, one is Touch the Black Breast Cancer Alliance. They are an awesome organization. Count Me In is another organization that enrolls Black women in breast cancer trials. Stand Up for Breast Cancer.
Okay.
Jessica Jones of Stand Up to Breast Cancer. She is actually a Black nurse researcher. So, talking to someone who looks like them may also help to increase the trust, to participate in a trial.
Right. Okay. Thank you so much, Doctor.
You are welcome. Thank you for the awesome questions. Anybody else before we bring it back over to Dr. Katrina to wrap up our session? It was so great to have you all. Carol, do you have a question?
Yes, I was just took the breath. I love the fact that you use the term baby steps, because when you mentioned that, I thought of baby steps as it pertains to everything you spoke about. For me, whenever I hear baby steps, or I'm telling someone baby steps, it had to do with exercise, where people say, well, I don't run, I can't run. Maybe take a walk every day. Baby steps on the walk. Maybe you can take a walk for 5 minutes, jog for 1 minute, take a walk for 5, those type of things. So baby steps to me is really applicable when it comes to physical being. But I'm so glad that you mentioned it, because I said, that applies to everything that you talked about, baby steps.
Thank you. That is
So
such
thank you for mentioning that.
Yes, thank you, Carol. That is so true. Because it's one step at a time. Sometimes when we look at the big thing that looks like this big mountain, sometimes it can feel insurmountable. But if we can break that big thing down into these tiny steps, now it makes it more manageable. It makes it more doable. Now we're more likely to think, okay, I could do this. I got this, or if you're a Christian, with God's help, I got this. I can do this. He's going to do his part and I'm going to do my part.
Thank you.
Oh,
Thank
yes. Oh my God. Your whole presentation was excellent. I mean, the way you broke everything down from different aspects of mental health and the Christian counseling. And I mean, it's excellent, excellent presentation. I'm just so thankful for you and that you presented tonight. And that Christian counseling, that really helped me, because not only am I spiritual, but I remember when I got diagnosed, and a dear friend of mine said, don't want to get, he was like, when you're going through something that hard, you need to stay in the word. You need to stay in the word, and you need to trust God.
you.
And that's basically what I did. I just kept speaking life and speaking, and through the process, even though it was so hard, just knowing that I had cancer, that just helped me so much, because I ended up having an estrogen positive hormone.
Okay.
So the doctors, they kept saying, you have to keep your stress level down. You gotta change your diet. You have to do this, you have to do that. So certain foods I couldn't eat. And I was like so devastated. I was dropping weight like crazy in the beginning, because I was like, well, what can I eat? I was scared to eat, and then I ended up taking this all natural product, which I'm still taking now, called Lavelle is Thrive, and just to help with clarity, because we have to keep in mind that our bodies are designed to heal themselves. We just got to put the right nutrients in our bodies to heal itself. Like you talked about the holistic approach, not mind. This all comes in mind, body, and soul. And you hit every aspect of that. And I
Yeah.
just want to thank you.
Oh, thank you so much. I'm so glad that you found value in that, because there is breaking down a stigma in the Christian community with getting Christian counseling, because you read the word of God, but
Right.
that doesn't mean that when you're meditating on the word of God later, you don't have these thoughts that pop up.
Exactly.
We have a million thoughts that flood our mind and go through our mind, and how we're thinking impacts how we're feeling. Then the combination of how we're thinking and feeling impacts what we do. So one of the evidence-based techniques that I use is called cognitive behavioral therapy, and it aligns perfectly with the word of God. You know why? Because the word of God tells us to renew our mind.
Yeah.
The word of God talks about our feelings and our behaviors. And so restructuring those negative thoughts to make those thoughts more constructive then causes us to behave more positively and more constructively. Finding out what are their core beliefs operating from some trauma that happened in our childhood that are causing us to feel a certain way. We go through all of that. So that's why it's helpful to add the Christian counseling to the word of God.
That's important.
Yeah. Thank you so much, Dr. Katrina, for inviting me and having me. Thank you so much to everyone that attended and listened to the presentation. I hope everyone was able to get something out of it. And I wish everybody the best, all of us the best on our healing journeys. Oh, thank you, Coletta. Said, thank you, Dr. Rose. This was great. Thank you.
And that's important about advocating. We got to advocate for ourselves.
Yes.
And then tell Dr. because Carol and I are both with American Cancer Society Cancer Action Network.
Okay.
And just tell us why, because I was telling her that you just recently joined. So just tell us what made you join, and all about why you love ACS Canada. And Dr. ACS Canada is important because we advocate to our legislators and let them know cancer is a priority.
Yeah.
And I've been ACS Can ACT lead, which is in my district, what it is when you're actually in your district as far as leading, helping advocate for to your legislators, all your legislators in your district. And I just as far as advocate, I do whatever I can to help. And then me and Carol are both. I think I gave you the information about the Black Volunteer Caucus,
Yes.
which is the number one affinity group that was. But now there's 6, but we were the first, and it was birthed in I think 2021, right, Carol? And what we do is we help with the sufferings and decreases in the community, and help encourage by the guidelines of the ACS-CAN, but we help with partnerships, training, and
Oh,
community engagement and recruitment, which like I'm trying to just like one of my New Psalmist Baptist Church Cancer Ministry. She's the president of our cancer ministry group. She's on here now. Her name is Constance. She's also a breast cancer survivor.
okay.
And I'm going to be presenting for our first meeting, talking about advocacy and ACS-CAN and the Black Volunteer Caucus. You know how important it is, but we need resources, and we need to have a more engagement in our communities, because we're dying at statistics. We are dying at numerous levels.
Yes.
So we need so much help and so much people to volunteer to help us with resources and just getting out there advocating for ourselves and advocating to our senators and legislators to get a whole bunch of bills that we need to get passed. And just like you was talking about the biomarking, to let them know how important the biomarking testing is.
Yes.
She touched on, I think you talked about that in your state of New Jersey, right? About the biomarker.
Yes. So I attended my first, I joined the South Jersey Volunteer Leadership Council for the American Cancer Society. I attended my first meeting like 3 weeks ago. And I joined ACS-CAN, and we had a meeting with a senator in my district, and we broke down topics, and I talked about understanding biomarker testing. Biomarker testing is so important because getting the blood tissue or the specimens from the cancer can help to create tailored treatments to very specific cancers. So biomarker testing is so important. So we were advocating for insurance companies funding to cover the biomarker testing so that we can have better, more targeted, tailored treatments to eradicate cancer.
Yeah, very important.
Yes. Yes. And I would love to have more information about the Black Caucus.
Yeah, Black Volunteer Caucus. Yes, fight. I think I'll send you the I think I sent Leslie, who was actually the president of she's a grassroots manager for BBC. And I sent her your information. I think, did you go on the website? Because it's fight cancer.
I enrolled, but I haven't heard anything yet, but I'm still looking forward to
Yeah, and then I actually sent her your information. I think she said she didn't see your information. So we're gonna get you there.
Okay. I'm looking forward to it. Thank you so much for the comments in the chat, everyone. I really appreciate it.
Thank everybody for joining tonight. This was perfect, especially for the theme for Women's History Month, for diversity, equity, inclusion. And you just hit on every topic and about advocating and everything. So just thank you so much for presenting for our first workshop of the year event.
Thank you for inviting me, and thank you for having this event, Dr. Katrina. We honor you, and we honor your staff, and we honor every woman on this call for Women's History Month. Keep being resilient, keep standing, walk in your power, walk in your authority, walk in your purpose, because we all have a purpose here on earth. We all have lives to touch. So keep on keeping on, ladies, and happy Women's History Month.
Yes. Happy Women's History Month, everybody. Thank you for joining.
Thank you.
All right, good night.
Good night.